welcome everyone to the People's House.
Mr. Speaker, will you please call the House to order?
The bill is passed.
This bill says that New York understands the breadth and the depth of the problem.
Camera and say, hi, I'm Tom Abinanti. Welcome to another Albany Update, where we have some conversations with people who come visit us in Albany and tell us about some of the things that the state government is doing that affects them and that affects the people of the state of New York. With me today is Iris Cognevich. Of course, that's spelled C-O-G-N-E-V-I-C-H. So it's not the Irish version.
No, it's not.
What's the background on that name?
Actually, it's Yugoslavian, and I'm from the Croatian side.
Ah, okay. But we're going to talk about what you do in Tarrytown, right?
That's correct.
Now, you're with a company named?
BAYADA Home Health Care. That's the company I'm with. I've been with them a little over 8 years, and we've been in Tarrytown about 12 years, providing services to the community.
And what does the company do?
We specialize in pediatric nursing for specialized children in their homes. We also provide adult skilled nursing in their homes, and we do home health aid services as well.
Now, you're located in Tarrytown. Where in Tarrytown?
We're actually 1 Central Avenue. We're 1 block off of Main Street on the corner of Central Avenue and Broadway.
Oh, right downtown.
Right downtown.
Okay. Now, you say that you provide home health services. What's that?
We actually go out to people's homes, and we provide clinical care to them underneath the direction of a physician in their home. That could be as simple as helping them with bathing and getting dressed and shopping and taking their medication, all the way up to tracheotomy care and ventilator care, and that would require nurses when we go out for those types of things.
So there was a time when people had to go to the hospital or to some specialized institution to do these things.
Yep.
Now they can stay at home in the comfort of their home and have somebody from your agency come help them out.
Absolutely, and our core mission is compassion, excellence, and reliability, and we do that with all of our patients, and we have great competencies, like you mentioned, so we can keep them in the dignity of their own home and not have to go to a specialized facility for those
How
things.
does someone get your services? They need a prescription?
They do need physician orders to get that. We do get it a lot from the hospitals, from the discharge planners when they see they're going home, because that's a care that a family member or a caregiver needs specialized help with, so a physician would recommend our services. We do get it a lot through insurances.
So you get insurance referrals as well as from the medical institutions themselves?
Correct.
Do you do private care, private pay, insurance, Medicaid, all of the above?
All of the above. We have a managed Medicaid client that we take care of right there in Tarrytown, actually, that we've taken out of Blythedale Hospital. And we also do the private insurances, and we have self-pay.
Okay. How many companies do what you do? Do you know?
Ooh, that's a tough number to guess. You're catching me off guard, but I would say...
what about in Westchester County?
I would say in Westchester County, there's probably 30 to 40 people that probably do some type of service for home care. I would say in the pediatric world, it's probably more down to about 10 to 15 of them that specialize in the pediatric, in the little babies.
Tell me a little bit about the type of care you'd provide to, when you say the pediatric care. I've seen, you know, we've all have parents
Right.
and adult relatives who need some help later on in life, and you provide that kind of help.
We do.
What do you do at the other end, at the pediatric end?
On the other end, we're helping out the little angels, we call them. They're all ages, from newborn up to age of 18. We classify them as our children, our pediatrics. Sometimes we accompany them to school. It could just be helping because they have a seizure disorder. It could be someone that has an autism situation and they need assistance on the bus with their medication and their feeding and their behavior modifications. And then we also have children that have SMA, which is spinal muscular atrophy, which is a more serious condition where they do need help breathing, which at that point they could be on ventilators and they could have tracheostomies in the home. So it's a broad range that we would take care of. We could be in the home for just a couple of hours a day to provide assistance, up to around the clock, 7 days a week. What
happens if someone in your care has an emergency? do you have a staff of people who come out, or what's the protocol?
That's a great question. We have really great emergency procedures that we have in place in each home based on the client's condition and what could go wrong, and having that equipment ready to go for when the problem happens. And we do annual competencies with all of our nurses so they understand each step they need to take as an emergency is happening. Once that emergency gets to a point where it cannot be managed in the home, we activate EMS and 911 would be notified. We also have a physician that we're operating under, so he's given us orders on those emergency procedures and each step we can take up until the moment we would have to activate EMS.
That would be the prescription, that would be the prescribing doctor, the doctor who in the first place said the patient needs your assistance or should have your assistance.
Correct, and it's typically their primary physician that's following up with all the cares of their needs.
The healthcare system is evolving quite a bit, as this discussion is showing. And more we're using people to the maximum of their capability rather than using people to the minimum of their capability. Mm-hmm. So you're now doing a lot of stuff that in the old days being just a few months ago, right? It's changing constantly. Were done in some kind of an institutional setting. Mm-hmm. What is the educational level of the people that you use as the caregivers?
That's a great question. Registered nurses would be used a lot of times when we're dealing with our ventilator and tracheotomy clients. That would be where we would need to go on a level. For maybe something that's not as life-sustaining, we can use a licensed practical nurse that could come in completely trained and able to care for those patients as far as providing medications, reporting to an RN that reports to a physician. And then the home health aide would be more of the non-medical, more of activity of daily living. That would be your bathing and dressing and helping with maybe reminders of your medication.
Who regulates this industry, which is a growing industry and clearly an important part of everyday life for so many people now?
Yeah. Department of Health regulates us and licenses us. And we also have places that do accreditations. So you have what's called the JCAHO accreditation, which is the Joint Commission that also does oversight for hospitals. And there's also the CHAP, which is the Community Health Association. They're the equivalent to JCAHO, but on the home care side of things. So there's an accreditation that's managing us, and there's also Department of Health who's licensing us.
The accreditation, is that on a federal level?
The accreditation, it's definitely probably more in line with on the federal level, but the accreditation, I don't know if it's really an option or not to do accreditation while you're licensed. I'd have to look into that for you, but I know that our company has always done the accreditation because it does take it to the next level of oversight.
Because there's been some discussion about the federal credentialing as being the minimum that we should be using versus just a licensed agency.
Yes.
And so I was wondering about whether your agency was accredited as well as licensed.
We're both, but we're not certified in the state of New York, which would be...
Oh, there's a third level.
Yes.
Okay. What's the certification?
The certification is where the federal piece comes into play.
Okay.
That's where you are in agreement with your federal certificate of occupation, which would be for your Medicare billing. That's where the federal piece would come into play. So in New York, you have licensed agencies, you have certified agencies, and all of those can be accredited if you choose to be.
Okay. That brings us to the question of, now that we're talking about regulation, why are you here in Albany today?
Well, today I'm actually here as part of the Association for Healthcare Providers, and we represent over 300 companies in the state of New York, and we're here advocating for our clients. There's a few things that have been put into play that are increasing the minimum wage that we need to provide to our caregivers, and we truly support that increase. We're just asking for help with the funding of that increase to cover those increases in cost.
Now you say help with the funding. I'm assuming private pay is not a problem. You charge them what you want to charge them.
That's correct.
Okay.
This will be more based on your managed Medicaid situation.
Now that raises a whole panoply of questions. We'll just deal with a couple.
Hopefully you won't go too deep.
Right. The state has been moving towards managed care for the Medicaid population of the state. I guess the effort is to save as much money as possible. And as I'm understanding the way this works is that instead of paying fee for services, the state now says to an insurance company that happens to be the one on the spot and says, okay, here's X amount of money for Mrs. Smith. You're going to take care of Mrs. Smith. We're going to pay you through Medicaid funds. She's yours. Take care of her. Is that the way it goes?
Yes.
And so where do you come in on this?
Well, we're the agency that they're contracting to come do what needs to be done to take care of Mrs. Smith, and we're paid the reimbursement from that managed care insurance company to provide that service.
So if Mrs. Smith needs to go to the hospital, this insurance company will pay the hospital bill. If she needs to see a specialist, this insurance company will pay the specialist. And if she needs to go home and have care, then they pay you to do that.
Yes.
But there are some state laws that's setting minimum wage for the people who work for you.
Correct.
And so what's the problem?
There's what's happening is we support this increase because our workers truly need it. Where we're having a problem is at times the reimbursement we're receiving is less than what they're asking us to pay the workers. So at times we're negative $1 or so per hour that we're with the client.
That's not a good business model if you're getting paid less than you have to pay your employees. It also, I would assume, affects the services that the people are getting.
It does. It's making it hard to deliver those services the way that those clients deserve to have that service be delivered, and it's making it hard to provide to that caregiver that's doing that service the way they deserve to be cared for.
Now, this usually gets taken care of in the budget, so I assume we need a certain amount of money in the budget, but how do we make sure that if we put more money into Medicaid managed care, that money gets to you to pay the workers and doesn't sit in the coffers of the insurance companies?
Well, that's where you guys come into play. We're hoping for that support that would put some language in there that would allow this money to come down to the licensed agencies to allow them to pay those care workers that are going out there and taking care of those clients.
Now, this issue of accreditation versus certification versus licensing has also come up. In what's that about?
What's been happening is we've been able to contract, licensed agencies contract with certified agencies to provide home health aid service to the community and to the clients that need it out there. What's come into play is there's some federal questions coming up that want to know if a licensed agency is really allowed to be certified, contracted with a certified agency. I think what ended up happening is they didn't realize they were going to have this little hiccup as they started doing the redesign of Medicaid, and when the hiccup came into play, they placed down a letter saying that this contracting can no longer happen between a licensed agency and a certified agency, and it went into effect immediately with no direction.
So the state tried to rearrange to save money, and in the process, by tapping certain funding streams directly, triggered some federal regulations that they didn't realize would come into play if they did this, and might be endangering the health, if we could say that, of many of Westchester's home health care agencies.
Yes.
And maybe in the process the health of so many of our people who depend on your services.
Absolutely.
So once again, sometimes change doesn't work out the way people want it to if they don't think very far ahead.
Yeah, and I think it's just tweaking a few things to make sure we're getting that care out there to those clients.
Well, once again, the legislature is going to have to step in and see if we can help out. I very much appreciate your comments and your explanation. You provide a very important service to our people.
Thank you.
So thank you for joining us today, and we'll see you soon.
Thank you.
Thanks. And thank you all for joining us. If we can be helpful to you, or if you have any questions, please don't hesitate to contact me or my staff at my office in Tarrytown, right down the street from where you are. Please join us again.